All right. So welcome everybody to panel number 2, Exploring and Addressing BPD and Stigma. We are delighted you could join us today. My name is Julia and I will be moderating the panel as a volunteer for Emotions Matter. While I'm doing the introductions, we invite you to write in the chat where you're joining us from. Welcome, I live in Queens, New York. Before we begin, if you have not done so already, please consider making a gift to fund Emotions Matter's peer programs throughout the year. Text to give or make a bid in the silent auction by clicking on the silent auction button. We have great items and this will make a difference in being able to continue offering BPD programs. So Emotions Matter is a 501c3 nonprofit organization founded in 2015 to support, educate, and advocate for those impacted by borderline personality disorder. To learn more about us and our programs, go to the website www.emotionsmatterbpd.org or head to the expo. As far as our philosophy, Emotions Matter strives to create a safe, judgment-free space for people with borderline personality disorder. We accept that there is a spectrum of experiences within the BPD community. We honor where people are on the journey without judgment or assumptions. We encourage people to define their own path toward recovery. We speak as experts of our own lived experience, not as medical experts. So first of all, we have Sara Masland, Ph.D. She's an assistant professor of psychological science at Pomona College, who studies how mental health stigma creates barriers to care for people with BPD, factors that contribute to stigma, and how stigma can be attenuated. She also studies emotion processing and personality disorders. Welcome, Sara. We also have Penelope D. Penelope has an MA in the social sciences, an MFA in creative writing, and a Ph.D. in English literature. She publishes poetry about the Sweet Valley Twins and short stories about kombucha. She just can't stop writing about borderline personality disorder. And lastly, we have Haley Amering. Haley is a peer facilitator for Emotions Matter's BPD online peer support groups. She is an advocate for BPD awareness and education and has utilized her lived experience with BPD to support others with similar experiences. So that's all from me today. Panelists, please take it away.
Right, who's going first?
Penelope, if you want to go first, that's fine.
Okay. All right. Hello, everyone. Let me, I'm going to go back and forth with the screen sharing. As you all are aware, this is a different platform, but what I'm talking about today, oops, sorry about that. All right. Okay, here we go. This is how I think about my stigma experience as transformative resistance. My relationship with stigma, as I'm sure it's true for so many of you, has been incredibly difficult. I've moved from resisting borderline personality disorder diagnosis so much it stopped me from getting treatment to engaging in something I call transformative resistance. I'll explain what I mean by that as I tell my story. I got diagnosed with BPD after I'd been in a psych ward for 5 days. One day I was bipolar and I was treated like I had a problem. The next day, borderline was on my chart and suddenly I was the problem. Suddenly everyone was talking about boundaries and I didn't understand. Nothing had changed about me other than the words on my chart, but how everyone saw me shifted. It's a tricky thing, stigma. Most of the staff at the hospital were kind people who genuinely wanted to help, yet they were deeply influenced by the values and beliefs their training had taught them about people with borderline personality disorder. They had learned we were manipulative, attention-seeking, taking up space in psych wards from people who really needed help. And in spite of the stigma, I felt cared about, which says a lot about how hard they worked to see me as a whole person. They didn't always succeed, but they really tried. Outside the hospital, I went back to graduate school in the social sciences, and I read every book on BPD that was available in the early 2000s. They were so judgmental. They were sexist. They were stigmatizing. If that was me, I thought as I read them, I don't deserve to be here. I got so angry at the books on borderline. That's what kept me going, even as shame and depression consumed me. I wrote a master's thesis trying to prove that borderline personality disorder was as made up as hysteria, which I couldn't prove that, even statistically. I went to DBT treatment, but I couldn't take it in. If anything from DBT helped, it just made me more ashamed because I thought if the DBT skills worked on me, then I must have borderline. And if I have borderline, I'm not worth anything. During my research for my master's thesis, I memorized all of the symptoms, learned the trigger words psychiatrists and therapists were looking for to diagnose borderline. I needed help, but after DBT, I refused to see anyone who thought I had borderline personality disorder. I went on this way for 12 years. Poet Irena Selva says, sometimes rage is the path through which we claim our space. And that's how it was for me. I raged and raged until I connected. And this is what I mean when I'm talking about transformative resistance. So first I connected to books, and 2 books in particular. These books were different than all the books I had read. So I read my books back in 2002 and 2003, and around 2014, I started reading again. Girl in Need of a Tourniquet was by a professor with borderline personality disorder. I saw myself in that book in a way I never had in a memoir about borderline. I looked up the author's website, and she had a blog post talking about BPD pride. That rocked my world, that someone smart and accomplished could not only be open about BPD, but was thinking about BPD pride. Then I read Remnants of a Life on Paper. This book did 2 things for me. It's a sad story about the loss of a family member because of failures of the mental health system. But it astounded me that Pamela, the woman in the book with BPD, had family members that cared enough about her to write a book. I related to Pamela too. Before her, I thought no one else with borderline had done the things I had. Deep down, I believed the things I had done when my borderline was the worst were unforgivable, that my family would be glad if I were gone because of the shame I had brought onto them with my mental health problems. Remnants showed me I was lovable. It made me realize that my family did love me, even if I was deeply flawed, made mistakes, and had borderline personality disorder. And after these books, I slowly started connecting to people. I joined PPD groups on Facebook. And again, it blew my mind that thousands of people were on there talking about their struggles, claiming the diagnosis, living their lives. I was so scared when I joined the groups that one of the few friends who knew about my diagnosis, I had her check my Facebook to make sure no one else could see I was in a group that had borderline personality disorder in the name. Eventually, I wrote to Lisa Johnson, and that's the author of Girl in Need of a Tourniquet. She introduced me to a Ph.D. student, Francesca, who also had BPD and was writing her dissertation on it. I'd spent 14 years in grad school working so hard to hide my diagnosis. I even left the grad program where I wrote about BPD, partially because I realized it was obvious I had the diagnosis. And then I discovered there were academics claiming it, writing about it, working on it. And they weren't just pathologizing it. Francesca was willing to work with me on an anti-stigma BPD project, and then I applied to be a peer facilitator for Emotions Matter and met so many more wonderful people with the diagnosis. All these connections are an antidote to the poison that is stigma. That poison got so deep inside me, I thought the only thing that would root it out was if the men who wrote the terrible stigmatizing books from the early 2000s apologized. Connecting to other people with BPD let me know I didn't have to wait around for them to start feeling better. Connecting with other people showed me I didn't have to resist the stigma alone. This is another thing I think of as transformative resistance. This is the cover of a website I worked on with that PhD student, Francesca, I met. We put together a website called Dysregulate, where we wrote back against stigma. I picked Cassandra for the website header, and that's who this collage features, because her story reminded me of how people with BPD get mistreated. Cassandra had the gift of prophecy in ancient Greece and spoke the truth, but she was ridiculed and disbelieved. I think borderline personality disorder has truths to teach the mental health system. I mean, DBT was developed to help a group of suicidal women that no other kind of therapy could help. And now DBT is used so widely for so many struggles. So adopting the myth of someone else let me know that stigma around borderline is an old story just playing out in a different form. It may hurt me and make my life difficult, but it isn't personal. And then finally, rewrite this story. And that's a picture I drew of neon that I like. For so long, it was so hard for me to say the words borderline personality disorder or hear a therapist say them. I still get wobbly in my chest when I say it, but the more I say it, the less power it has over me. These days, many of the books that come out about borderline are not as obviously stigmatizing. There's a big shift. The fact that we're here at an event called BPD Fest is evidence of how things are changing. And I just want to take a moment and just like revel in the fact that this is called BPD Fest. It never would have occurred to me years and years ago that I could be at something and be like, yeah, we're going to have a festival about BPD. It's awesome. It's really evidence of how things are changing, and I'm so grateful to be here. But one of the things I do to rewrite the story is many of the pop psychology books about trauma or bipolar or addiction that come out these days, they'll sometimes drop in a sentence about a difficult patient with borderline personality disorder. So I write the authors of these books emails, and I tell them those sentences just end up pairing borderline with difficult in people's minds until people associate BPD with difficult and they don't even know why. I tell them that unless they're going to write about the complexities of these diagnoses, maybe you should just describe the person's behavior and leave out the words borderline personality disorder, because putting them in there in such a pejorative way serves no purpose to their text and ends up causing problems for us. For example, in 2015, after I accepted the diagnosis, I wrote an essay about my experience with stigma, and I won a national prize. At the awards ceremony, the writer giving me the award said, "You're not a borderline personality, are you?" I think about this moment because it has so much to teach about the power of stigma. The writer that gave me this award was well educated, well published. I deeply respect him. But I didn't fit what he thought borderline looked like, even though my essay described the experience of having it and resisting the diagnosis. So because I didn't look like what he thought it should, he concluded I must not have it, not that what he'd learned about borderline might be wrong. I'm going to close today by reading the final paragraph of that essay. In it, I'm still searching for some outside approval for someone to tell me it's okay I have borderline, which is part of my path, needing that reassurance I'm okay from people without BPD. And I'm glad I'm reaching beyond that now, where through connecting with others, connecting with history, rewriting the story of BPD is transforming me. Here's the final paragraph of that essay. It's called What My Bikini Revealed. I remain loyal to bikinis. I'm 41, and like my mother, whenever I can, I slip one on and lay out. Even when I lived in South Louisiana, where summer heat indexes regularly hit over 100 degrees, I bought a folding chaise for the tiny grass triangle between my apartment and the laundry room. It took pure willpower to make it 30 minutes in the Louisiana sun. One day, as I sweated in my bikini, the building manager whistled as he stepped around me to get into the laundry room. Quarters jangled inside a pouch as he came out. He nodded at me. "Nothing wrong with it, nothing wrong with it," he said. He strolled past, his cigarette smoke lingering in the still, humid air. It was surprising and kind of creepy, but I wanted to take him back in time with me, back to the day I read the words borderline personality disorder next to my name. I pictured it. He would exhale smoke, squint at my chart. "Borderline," he would say. Whistle long and low, nod. "Nothing wrong with it. Nothing wrong with it." That's it for me. I'll pass it to Haley.
Thank you so much, Penelope. Just beautiful job, really touching. I don't know how I'm going to follow that up, but really thank you so much for sharing. And welcome, everybody. Thank you so much for joining us today for BPD Fest. My name is Haley, and I'm here to talk to you about my personal relationship with stigma and how it has impacted me in my own recovery journey. And now, I would like to sit here and say that prior to my diagnosis, I didn't experience any form of stigma surrounding my mental health, but I can't. The truth of the matter is that stigma has itself attached to every mental health diagnosis and every symptom. And I just want to take a second to even reflect on that. Even if an individual does not meet criteria for a mental health diagnosis, the symptoms that they experience still have a negative connotation in our society. And while I could talk about the impacts that stigma has on the realm of mental health as a whole, it's not why I'm here to speak with you today. It bears mentioning, though, because if we are trying to think of ways to rid stigma and lessen it, we also need to think of ways to be proactive and try to prevent. So this kind of includes if we were able to address that stigma impacts individuals without a diagnosis. We can also help lessen common symptoms of those who may be developing BPD. When I was 18 years old, I had a diagnosis of bipolar 1. And I was prescribed on so many medications, and time again, they had proven to not help me. And it made me so confused because the diagnosis I had just didn't seem to fit how I was feeling. Yes, I had mood swings, and yes, I had poor impulse control, but there just seemed to be more to it. My friendships always crashed and burned after a short period of time. I was terrified of being left, and I didn't know who I was. This level of awareness did not lead me to immediately seek help, though. I felt stuck. I felt like I had been through so much already and that I already received so many other diagnoses and prescriptions, and I was fearful. Fearful that I may receive a diagnosis that I knew nothing about, and fearful that I would officially be ruled crazy, which was one of my biggest fears. What if I receive a new diagnosis and no one wants to talk to me anymore? I thought. This was the first major way in which I was impacted by stigma. So, for about a year, I grappled with this disconnect of what was occurring on paper versus what I really felt was going on. The fear of being judged and not accepted was greater than my drive to help myself. But it got to a point where I could no longer allow the weight from the surrounding stigmas to crush me anymore. It was time to take that power back and to no longer give it to all of the what ifs and hypotheticals. I knew that I had to do something different for myself if I ever wanted to see a change in my quality of life. So I sat down with my laptop and researched clinicians in the area that specialized in treating mood and personality disorders. I did this for hours until I found someone that sounded like a good fit for me. I didn't give up until I finally felt as though I had built a foundation for my recovery that was sturdy enough to hold all of the weight from the potential progress that was about to follow. This is the second way that stigma greatly impacted my recovery journey, because it acted as the fuel for me to do better for myself. But it certainly doesn't end there. See, in the beginning, stigma paralyzed me with fear. It made me avoid seeking help, and it prevented me from living a fulfilling life. But I realized that if I did nothing, the stigma was there. And if I did do something, the stigma would also still be there. So either way, I knew that I needed to just rip that band-aid off and do what was best for me. But now, stigma is the reason that I am speaking out about my experiences in an attempt to raise awareness and help others. This is the most salient thing that has happened to me due to experiencing the impacts of stigma. Much like the practices of dialectical behavior therapy, I learned to allow my conflicting thoughts and emotions to coexist. Yes, stigma caused a great amount of pain and still does from time to time, but it also motivates me to keep moving forward. With my efforts and the efforts of this amazing community, I know that a difference is being made in one form or another. I'm not going to lie. My journey has not been easy, even though I can sit here today and tell it with a smile on my face. There were times where I gave up in seeking help, and there were many days where I didn't even get out of bed. But there have also been so many days where I wake up grateful that I took that first, ever so terrifying step towards recovery. The lows that I have experienced have caused me to appreciate the highs, and vice versa. Without both pain and joy, I wouldn't be the person I am today. Stigma crushed me. It intimidated me, it made me question my quality of life, and it knocked me down more than once. But it also made me stronger, and it made me wiser, and it made me a better advocate. Now, I wanted to end with a quote from my favorite social worker, Brene Brown, and it has encouraged me to step outside of my comfort zone and has really helped me so much along my recovery journey. It goes a little like this. Vulnerability is not winning or losing. It's having the courage to show up when you can't control the outcome. So, I encourage you all to embrace the vulnerability that comes when experiencing, educating about, and advocating against stigma. Because if we never try, we'll never know. Thank you.
Wow. Thank you, Haley and Penelope. I think that your stories are really powerful. And I'm going to look at things from a slightly more academic lens. And I just feel like it's so hard to follow up the power of those stories with this academic information. But I do want to have a chance to, offer some resources and a little bit of background so that the panelists or the attendees have a sense of how someone coming at this from the perspective of a clinician and a researcher might be thinking about stigma. So I am primarily a researcher right now, but I am also a licensed psychologist, trained in treating people with borderline personality disorder. And my first experiences with stigma about BPD actually started in college. So when you learn about BPD in your first psych classes, it's often talked about in pretty pejorative ways. And I'm someone who naturally kinds of questions that kind of pejorative language. And so it actually piqued my curiosity pretty early on. And I found actually pretty problematically that the pejorative language used around BPD permeated every level of my training. Which is paradoxical because clinical training is supposed to help you understand people. And what I found instead is that when it came to BPD, I was often exposed to lots of misunderstandings about the disorder. And because I think I'm naturally someone who pushes back against that kind of thing, I didn't internalize the myths about BPD and the pejorative language. But I think that many people in my position do, because you trust the people who are training you to have a sense of, what the reality is. And so that's kind of where how I came to be interested in researching stigma, because, I'd be sitting in a class and learning something negative about BPD or hearing something negative about BPD from a clinician. And then I would actually go to a clinical placement and I'd be sitting across from someone with BPD and thinking, this doesn't fit, right? Why did that person say that? Why would you describe someone with BPD in this way? And I started to think about that both from a clinical perspective, but from a research perspective as well. So I'm going to share some slides here. Okay. If you can't see my slides, please let me know. Because the share looks a little bit different than it did before. Okay. I'm not hearing anything, so I think we're probably okay. Okay. So I'll say a little bit about why BPD is so stigmatized to give some context around that. I'll talk about levels and types of stigma, and then I'll offer some solutions for empowerment and combating the stigma. And I will highlight the ways that this intersects with what Haley and Penelope have said, because I think that what they've offered in terms of how to combat stigma, I think that those things are actually the most powerful. So I'll try to highlight those too. So stigma is a mark of disgrace associated with a particular circumstance, quality, or person. So when we say that BPD is stigmatized, what we mean is that the label BPD, borderline personality disorder, has come to be taken as a mark of some kind of disgrace. And that isn't necessarily a given, right? We use lots of labels in life that are not associated with negative or pejorative ideas. And the question then is, well, why did this label, which actually was first meant to be just descriptive, how did that come to be associated with negative ideas in the eyes of the public or clinicians? And a lot of it has to do with the history of the term. So the term was originally just descriptive. The term borderline, it just meant to refer to the border between psychosis and neurosis, and it's a little complicated what that means. And actually, that's not how we currently understand borderline. The nuance of the theory about BPD has grown exponentially, and this idea is somewhat antiquated, although it's still used in some schools of thought about BPD. The problem, though, is that the term was also quickly adopted as that literal kind of stigma. So I think in part because people didn't understand what the term meant to patients who were deemed difficult, or for those for whom treatment wasn't working. Because at the time, and we're thinking now in the early 1900s, 1940 maybe through 1960 or so, when the term was first used, we didn't have good treatments for BPD. So maybe this was sometimes applied to those patients who were called difficult because treatment wasn't working, but treatment wasn't working through no fault of their own. It's because we didn't have the effective treatments yet. And actually, most of these people were women. And so I think that this intersects with something that Penelope said, where she tried to deconstruct the BPD diagnosis as something that was unreal, like hysteria, right? Another thing that might be used to subjugate women in some way. And unfortunately, the history of the borderline diagnosis is that it actually was used or weaponized against people with women in the early years. So when the disorder was actually formally articulated in 1980, this means that we actually got real criteria for the disorder, those 9 criteria where you need 5 of 9 of them to get the diagnosis. When that was put into our diagnostic and statistical manual, research skyrocketed. And I have some stats up on the screen that you can see about like just how much it increased. So 95 times more publications than before it was put into the DSM. However, and this is, more than, schizophrenia over the same period. So we know that there's a hopeful course and good treatment options because of this research. So this research has really revolutionized how we understand BPD, the treatment options that we have. But unfortunately, sometimes there's a big gap between those research understandings and the way that BPD gets stigmatized. And unfortunately, there are still research papers that come out even today that use pejorative language about BPD. So I don't mean to suggest that all of this is historical, but a lot of it is. So factors that also contribute here include a lack of training. There's a stat actually that in the United States, there's only 1 person trained in a formal evidence-based treatment for BPD for every 6,000 people with BPD. And that is staggering. And as you can imagine, that creates barriers to access care. But what it also means is that you have a whole host of people who aren't trained to help people with BPD. And the reality is that when you're treating someone with BPD, there are really significant concerns, oftentimes, not always, with things like self-harm, with things like suicidality. And these are things that can cause a good amount of kind of anxiety about treating someone, right? About helping someone. because the consequences of not helping can feel so great. And when you don't have the training to manage that, sometimes you can even misinterpret your own kind of emotional reaction and blame the patient. So you know, that's one way that training might be an issue here. Another is that not only do people have the lack of training, but as I said, pejorative ideas about BPD actually permeate academic spaces, and the training is actually sometimes wrong. And so there are, I don't mean to cast a bleak image of this, because there are lots of initiatives that are working to change this, and we're making really good progress, but it is one reason. Also, the lack of treatment options before the 1990s and difficulties with treatment access themselves might perpetuate stigma and are also caused by stigma. So all of this, too long didn't read. If you listen to none of that, I think what you could take away from this is just that much of why BPD is stigmatized boils down to just misunderstanding. It's actually the case that the people who perpetuate stigma about BPD the most are those often who don't understand BPD. And that's not always true. I think sometimes the people who do understand BPD can still say some things that are just wildly off the mark and problematic, for sure. But what I want you to take from this is that if you're feeling like you're being stigmatized because of your experience of borderline, know that the person doing that stigmatizing isn't doing it because they have any kind of accurate view of you, right? It's actually because of some level of misunderstanding. So we also think about stigma in terms of levels or layers. Just to give you a sense of this, I think it's important to think about the landscape of stigma as you're trying to navigate it. So structural stigma is that stigma that occurs within systems to do things like exacerbate difficulties with access to care or to discriminate directly against people. So this would be something like training programs actually not training people to treat people with BPD. That's a structural stigma. Or insurance companies not reimbursing in the same way for treatment for BPD. That's a structural stigma as well. And this contributes to, and is probably also affected by, public stigma, where the public, and here you could include clinicians, but you can also include just the general public, might hold stereotypes or prejudices, and also discriminate against people with BPD or another mental health condition. And then the one that I want to highlight here is self-stigma, because I think that both Penelope and Haley have really spoken to the experience of how being exposed to stigma structurally or in the public impacted how they were thinking about themselves as well. How they accepted the diagnosis, for example, or how they navigated understanding what the diagnosis meant for them. And self-stigma can be really difficult to navigate because you're taking these ideas from the public and you're starting to think negatively about yourself in some way. And if you think about what we know about BPD, this intersects really harmfully sometimes with the negative sense of identity that people with BPD already have. So this is the internalization of stigmatizing ideas and feelings. It's often overlooked actually in the research and I think also in treatment. Some people with mental illnesses experience losses to self-esteem through self-stigma, but paradoxically, some people are reactively energized and express righteous anger. And I think this is something that's really beautiful about what both Haley and Penelope have highlighted, through this idea of how stigma motivated them, or through this idea of transformative resistance, which is that there's a way that you can take this stigma and say kind of like, F you, right? Like this is wrong and I'm going to do something about it, right? And I encourage you all to think about what that might look like for you. And of course, resistance is going to look different for every individual, right? It won't always come out as kind of like a righteous kind of anger. but sometimes it might. And then others are able to kind of ignore stigma and are seemingly unaffected. So reactions to stigma vary in a whole number of different ways. And little research, as I said, on self-stigma has focused on BPD specifically, and what exists does suggest that it's greater than for other disorders, and it can be associated with low self-esteem and poor well-being. So I just want to highlight that it's something to attend to, and I'll give some ideas for how to do that. So what can you do about stigma? So Penelope and Haley have highlighted a number of ways that they've fought back against stigma, really beautiful ways, through art, through writing, through education, through finding the information. And that's wonderful. I would also say, again, that recognize the stigma comes from misunderstanding. Those who stigmatize you and your loved ones likely do so because they don't understand in some way. This is even true of many mental health professionals. And stigmatizing views are therefore not an accurate representation of you or your situation. So as I said, this is a double bullet point, but remember that transformative resistance can take many forms. Oops, double slide, I apologize. Also, what you can do is to educate and empower yourself. So learning about BPD, interestingly, is a treatment itself. So we call it psychoeducation in clinical or research settings. And when you teach people about BPD who have BPD, you give them the real information about the disorder, that actually itself improves the symptoms of BPD. It's a treatment. It's a really beautiful thing. So seeking education is one of the best things to do. And you can do this through books, websites, research, and other avenues. And I'll give you some examples. So first, I want to point you to Emotion Matters resource guide. So this is available on their website, and it has some really great resources that have been vetted by peers with BPD who have kind of screened these to say, you know, if there's stigma in these sources, it's somewhat minimal. And it's outweighed by the benefit of using these sources. So here's just a couple of examples. Some of these are written by academics. So this first one, the Borderline Personality Disorder Survival Guide, and some of them are written by people with the lived experience of BPD, including the book by Marshall Linehan, and some others, including this one, Conversations on Borderline Personality Disorder. Websites can also be really helpful. Again, there's a list of websites in the Emotions Matter resource guide, but some examples. I'm a big proponent of practicing self-compassion. I think it's really important for people with BPD, even if we're not thinking about self-stigma, because of the negative sense of self-concept that people sometimes have or often have. And this is one website where they have some guided meditations on self-compassion and some other exercises that are really useful. There's some others. So BPD Demystified gives some real information about BPD. NEA BPD also is a good source. And McLean Hospital has resources, including free family webinars. This is another source that's not in the Emotions Matter guide, but that I like. It's a YouTube channel where they deconstruct stigma and interview people. And it's just full of really good content. And most of it, at least 50% of it, focuses on the lived experience of BPD. So research, you can also find original research to educate yourself about BPD. And you can do this through scholar.google.com. If you want to go and look at the kind of primary source research that people are doing about the disorder, you can go there. And then one of the problems is that oftentimes you might not have access to the articles because it requires affiliation with a university or college. But there's a way around this, which is that if you go to researchgate.net, you can actually directly request the article from the authors. And this is a really great way to do this rather than buying an article. I would never suggest buying an article because that money just goes right to the publisher. You can just go to the author and say, you know, could I please have your publication? I'm interested in it. And I get lots of these requests through ResearchGate. This screenshot just shows what this looks like. Someone asked for a full text of my publication, and I'll do that. I'll send them the publication, and then they have it. So that's another way to get direct access to the research to empower yourself. Also, connect. This is something that I think came through really clearly in Penelope's story of finding some kind of connection. So peer support groups are definitely important, and Emotions Matter is a great resource for that. But also to recovery stories and other personal narratives, you can find information in other places. So books, blogs, video materials, and Twitter even. And again, see that resource guide, because I will say there are some books, blogs, video materials out there that are completely stigmatizing. Penelope spoke to that as well. Those early readings just totally kind of presented a problematic picture of BPD. It's good to have the vetted resources. Here's some Twitter examples that I pulled out, and these aren't people that I don't know them. I just follow them on Twitter, and their content seems pretty good, but I haven't, fully vetted it. But they're two people who put themselves out there as advocates for people with BPD, and they provide really great information. There's a whole community of people with BPD on Twitter, but I will add a cautionary note that if you use the hashtags, you're going to find mixed content for sure about BPD. Safe disclosure can be really important. So connecting to others and sharing your diagnosis of BPD is something that can be affirming for you when done in a safe relationship, in a safe environment. And it's something that can also help deconstruct stigma for others. And also advocacy can really feel empowering. That kind of idea of resistance can be really good for you, but also really good for destigmatizing BPD more broadly. And again, we should always highlight family and patient voices. Therapist issues. I want to say a quick note about this. So finding a therapist can be difficult when you have BPD. Remember what I said about the number of people trained versus the number of people with the disorder. It might take several tries before you find the right fit. That's the unfortunate reality of the situation right now. But here are a couple of resources. If you're interested in DBT, you can find therapists directly through the Behavioral Tech website. And then this is a blog, actually, this link, and I can make my slides available to anyone who's interested. But this blog link actually has some good tips for finding specialized treatment for BPD. But the thing is that you don't necessarily have to seek out one of these specialized treatments for BPD. My colleagues and I did what's called a meta-analysis a while back, looking at treatment as usual, so treatment that you might just get from any community clinic for BPD. And we found that any treatment can be useful. It really depends on your relationship with the therapist and whether that therapist is someone who's excited to be helping you, right? How much stigma they're carrying about BPD. And so I would say that you have the right to ask questions about that, because you have the right to good treatment. You have the right to know how your therapist has been trained and what attitudes they have about BPD. And if they're not a good fit, you have the right to ask for a referral to another provider, and they need to provide you with that referral. This little picture up at the top, I just put in the zip code 12345 into the Psychology Today Therapist Finder, which is Schenectady, New York, I guess. And what I found there is that if you select people who specialize in BPD, or you select BPD as one of the target areas, there's a whole list of people who say that they're basically excited to be helping people with BPD. So that's one way that you could also start. And that's a good mix of people who have training in specialized treatments, some maybe who don't, but are still interested in working with people with BPD. And there's also a good range of costs associated with people on the Psychology Today Therapist Finder. Many accept insurance, many have sliding scales, that kind of thing. So in summary, BPD is stigmatized. That's the reality. It's largely because of misunderstanding. Public instructional stigma can be internalized as self-stigma, but you really can empower yourself through education, connection, transformative resistance. You have the right to treatment with a professional who knows how to help you and who wants to do so. I think that's such an important part of it. Someone who wants to be helping you. And BPD has a hopeful course and effective treatments. So there's a message of hope to be taken away here, that even through all the stigma, the research has shown now that we have these really effective treatments. And I think that over time, as we learn more and more about BPD and as people start to really attend to stigma, hopefully we will see the stigma abating. There is evidence that it's getting better in the research literature itself. So that's a good thing. But please don't, I would say, please don't let stigma be the thing that keeps you from seeking help, as it so often can be, because there are those effective treatments out there and there is good hope. Thank you for your attention.
Okay, great. So maybe we'll move on to doing some Q&A now with everybody. I have a couple of questions in the Q&A here. We had somebody asked about getting the slide decks from the attendees, if people are willing to share that. Also, I believe all of these panels will be recorded, so you'll be able to go back and watch and see the slides again if necessary. Okay, let's see, we have another question here. So somebody asked, do you think calling BPD emotional dysregulation instead helps lower stigma? Any thoughts on this?
I'll jump in. I would say absolutely. Like if they had come to me in the hospital and been like, you have an emotional dysregulation disorder, I would have been like, yeah, I do. But the term is just so embedded now. I'm not sure if changing the name can I'm not sure we can escape it. I think we'll always have to engage with it in some way. But I do that term does, I feel like, relaxed when I hear it. So that's my response.
This is something that I'm studying actually right now. So how different terms or the way that we refer to BPD itself might perpetuate stigma. So like, for example, it's very common to hear people people say things like she's a borderline rather than she's a person with borderline personality disorder. There's been questions about like, does that result from stigma? Does that perpetuate stigma? I think it's a little unclear still. But also I think that there's been a big push to rename BPD, and actually in the ICD, which is the International Classification of Diseases, it's been renamed as emotionally unstable personality disorder, which I think is a little more stigmatizing than emotional dysregulation. But I think we need a sense of what people in the community as a whole want the disorder to be called, but then also a good sense of how it's going to impact attitudes. So stay tuned. We don't know yet from a research perspective. But certainly I think the term emotional dysregulation has better kind of like face validity. Like as Penelope says, like, oh yeah, like that makes sense. What's this term borderline, right? Like what does that mean? It's not as clear.
Okay, great. I think that might be it for the questions in the Q&A. Yeah, I think that might be everything unless anyone else wants to add any questions. Maybe I'll give it a minute or two here for people to add anything else. Okay, if anyone has any more questions, feel free to send them in the Q&A.
Chat, Siobhan is saying that they find the term emotionally unstable personality disorder more stigmatizing. I imagine, I think, Siobhan, did you say you were in the UK? So that, maybe earlier. So I think that that would be using the ICD classification. That's interesting. And Alex is saying something about how she's also experiencing some exposure to stigma in her training. So yeah, that's an experience I definitely have shared. It's something that some people are working on, but it's a big problem. And you say, Alex says, I'm also afraid my classmates will find out, and at the same time, I want to let them know to help with stigma. What are your thoughts? I would say that first off, in that situation, it is not your responsibility to be the person who stands up for the whole community. So I would say, don't do something that doesn't feel safe to you. And from my perspective, I would think about if you want to be disclosing that, to start with safe relationships. But I would love to hear actually what Penelope and Haley think about this. Like, how do you go about navigating the disclosure when you want to do something about stigma, but you're also in a situation where it could be dangerous to you?
For me, a big part of it is kind of just like getting a feel for like, who am I speaking with? Like, and as hard as it is sometimes, like if I don't feel comfortable, that's kind of the boundary that I have to set. I can't sacrifice my comfortability for the sake of being able to advocate, as much as I am very passionate about it. So a big thing for me is just like, am I comfortable? Like, and am I okay if things go south? Am I okay, like, if the stigma like starts coming out of this person that I'm talking to's mouth? Like, can I handle that? And if the answer is yes, then I, by all means, I am willing to educate. But sometimes there's just the pros and cons. And for me, it's if my comfort isn't, and I don't, press as hard as I really would if I was comfortable.
I'll just say first, thank you, Alex, because we need people who are getting clinical psych degrees who have the lived experience of borderline. Like I always like to point out, like, DBT came from someone that had lived experience, and it not only changed the landscape for people with borderline personality disorder, but it changed the landscape of therapy in general. Like, it just had this massive ripple effect. The work I know, the academics I know and that I read who are really open about BPT are not in clinical psych programs. They're in English, they're in gender studies, they're in disability studies. They're in places where there's an ethos and a sense about oppression and injustice. So I was in the English literature program, and I was still too I'm too scared to do this. But my first reaction, like with clinical psych, is like, no, because you have a whole committee of people like who might hold those stigmatizing views. That me personally, I would wait until I had the degree and then be like, guess what, all y'all, like, I need to tell you something now. But I would wait until I had my dissertation signed by my committee, because that's just my experience of graduate school.
All right, do we have any other questions? Seems like no. Okay.
Oh, I do want to echo what Sara said about it's not your responsibility to fix everything for everyone, because that was something when I first read those books, and I was just like horrified at what was happening in them. Some of them I'm still horrified by. I got really stuck in like, I have to fix this. I have to stop this for other people. And like, part of like my, method of transformative resistance is thinking about like, where do I have power and where do I not have power? And it's not all on you to change it in a whole program, but that doesn't mean that it's still incredibly painful to hear those things and see them and watch them being taught. Like, I can't imagine just how painful it was to read the books, but I was in a program where they weren't, the sociology, no one was talking about borderline personality disorder, but like to hear it would just, I would feel like I was being stabbed, I think. So I wish you like tons of good self-care.
The peer resources, in the book section, there's a anthology of short stories about lived experience of BPD that was edited by Perry Hoffman and John Gunderson, I think. And one of those is the experience of someone who was exposed to stigma in a training program. So I might direct you to read that story if you're interested in reading about experiences that might or might not be similar.
Seems like that would be a useful resource for anyone pursuing clinical psychology to read, just in general, right? Yeah. All right, great. Well, if we have no other questions, do you guys have any final words you want to say? Is everybody good? Okay.
I want to thank Penelope and Haley again for sharing these stories. I was really moved listening to both of you, and I think that you're doing the most important work by sharing those stories. So thank you so much.
Absolutely, incredibly moving. So I guess on behalf of Emotions Matter, I want to thank our panelists today for sharing and for this insightful discussion. And thank you to the attendees for the questions. If you have an individual question that was not answered, you can connect with the presenters in the People Profiles Engage button on the left-hand side of the panel. There are also resources, which are downloadable links related to this topic at the end of the screen. And don't forget to check out the silent auction and text to give. And thank you so much, everyone, for coming. Thank you, panelists, for speaking. This has been a really wonderful experience. Thanks, everyone.